We are joined now by Dr. Simone Wildes, in for Dr. Jen Ashton today, here to answer some of your key questions on coronavirus. Dr. Wildes, thanks for being with us. So we'll start with the first question. What are some of the factors being considered to determine whether a sport is high or low risk?
Yes, Amy, this is a common question we get at this time as students are returning to school and getting involved in extracurricular activities. The risk for this varies from sport to sport. There are few things that we need to consider whether or not it's a contact or non-contact sport, whether or not you're going to be sharing equipment and or gear, and are you able to practice social distancing during that sport. I would really encourage you to take a look at the CDC guidelines, which really outline the risk that's associated with each sport.
I'm really interested to your answer in this next question, question 3. What are the factors contributing to New York's low infection rate?
Yes, New York has done a really great job with regards to setting the bar for the rest of the country with how we need to slow the spread of the COVID virus. And the reason they have been able to do that is they've used a phased, data-driven approach with regards to controlling the virus. And by that, they have done rapid testing with quick isolation and contact tracing, and they've coupled that with a messaging of masking, hand hygiene, and social distancing. And moreover, what we have seen is when they've heard about hotspots, they have shut those things down. For instance, with the bars and indoor restaurants, they have really closed down, shut it down. But the big thing they have used, which has really helped to galvanize their message, is strong leaders to say consistent messaging over and over to the resident. I think that has really helped to get the message out and help to slow the rate down of the coronavirus.
All right, Dr. Wildes, last question. Are we seeing an increase in infections for children who have returned to in-person instruction?
Yes, I have to say that we have seen an increase in the number of cases in children. In fact, the American Academy of Pediatrics just came out with some data that shows there's been increased number of cases, hospitalizations, and even deaths. And there was also another study that showed that there's been approximately 100,000 cases of COVID-19 seen in children that went back to school at the end of July. So, we do see COVID-19 in children. It's not a respecter of age. We have to be vigilant in making sure that we do everything we can to mitigate the risk of the COVID-19 in children.
All right, Dr. Simone Wildes, we appreciate it, and our doctors will be in the house all week. Jen will be back next week, so you can submit your questions to her on Instagram at Dr. J. Ashton.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.